Welcome to Patients at Risk, a discussion of the dangers that patients face when physicians are replaced with non-physician practitioners. I'm your host, Dr. Rebecca Bernard, and I'm joined by my co-host and the co-author of our book, Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare, Dr. Naran Al-Ajba.
Good evening.
Nurse practitioners are registered nurses that receive at least 1 year of additional training and 500 clinical hours to be licensed. Physicians are medical doctors or doctors of osteopathic medicine that receive a minimum of 3 years of training after medical school, which includes 15,000 hours of clinical experience. Yet, despite the differences in education and training, nearly half the states in the union now allow nurses to treat patients without physician involvement, even though there's no clear evidence that independent practice by nurses is safe or effective. Each year, nurse practitioner leaders fight legislative battles to gain independence in states that do not currently allow independent practice. And today, we are joined by Dr. Jennifer Bryan. She's a family physician and the chair of the Board of Trustees of the Mississippi State Medical Association. She's here to discuss the approach that the state of Mississippi has taken to protect patient access to physician-led care. Dr. Bryan, thank you for joining us.
Thank you for asking me to be here. It's an honor.
Jennifer, can you start us out by telling us about HB 1303, which was the Mississippi legislature's recent bill to allow unsupervised practice of nurse practitioners?
Absolutely. Thank you guys again for having me. It's such an important topic, and we did have a bill drop in the House of Representatives. It was authored primarily by a nurse practitioner who is in the state legislature, so it came through the House side first. It moved rather quickly there, and so we didn't have much opportunity on the House side to debate and to engage our lawmakers. So the battle really waged in the Senate, and we fortunately were successful there this year in getting that to die on the calendar in the committee. Of course, it was a little close for comfort, but we feel like our successes were based on the fact that we started a campaign about 2 or 3 years ago to build together our partners who recognize the value in physician-led team-based care. This was a piece of legislation that would have allowed nurse practitioners independent practice in primary care in the state of Mississippi. And of course, we had concerns regarding patient safety.
Thanks so much for that. Yeah, I have the bill in front of me, just some of the text, just to read a little bit of what they were seeking to do, which was, first of all, I just think it's really interesting that they started out by kind of defining what an advanced practice nurse was. And this is what they said. This is a person that they're, seeking independence, a registered nurse that has completed at least 1 year, one academic year to prepare for advanced or specialized practice, certification by a board approved certifying body. And that is really basically 1 year of training after being a registered nurse. So this is nothing compared to what physicians go through. So first of all, and then secondly, what this bill would have done would have, number one, allowed nurse practitioners to collaborate or be, I guess, supervised by another nurse practitioner rather than a physician. And then further, after they completed 3,600 hours, they would no longer require any kind of collaboration or supervision with a physician. So, 3,600 hours, that's not a lot of experience or time.
No, it's not. And actually, just listen to it again, it was targeting primary care, but it also opened up CRNAs. It opened up several other fields because it really did not specify, although all the talk and the hype was about primary care. We felt like there was an arbitrary designation for the hours of training, and also had obvious concerns with nurse practitioners supervising other nurse practitioners. And honestly, some of our biggest allies were on the ground nurse practitioners who enjoy being part of a physician-led team.
Yeah, so I wanted to talk about some of your strategies that Mississippi took to fight this bill because first of all, congratulations, you were successful. And I can't say the same for a lot of other states. My own state of Florida, we lost independent practice for primary care nurse practitioners this last year. And so I think what Mississippi has done can be model examples that we can use in other states and because it worked. So what you did was amazing, and I'm so impressed with it. So I wanted to kind of go through what I saw that you guys did, and you can help me understand. First of all, you mentioned collaboration with other groups. And I saw you shared on Twitter a letter from the American Academy of Dermatology And also you had support from the governor actually of the state of Mississippi. Tell us about some of the other collaborations that you had.
So yeah, we have a great relationship with the current governor, Tate Reeves. The letter you're referencing was previous governor, Phil Bryant, who our medical school actually is named after. We did some renovations there. So we've got a great relationship here in Mississippi with our governors. The strategy started about 2 or 3 years ago. We applied for a grant with the American Medical Association for a scope of practice, kind of funding our campaign. We self-funded and then they self-funded some. And part of that was we started a state scope of practice partnership, whereas we reached out to like-minded groups, all specialties. The physician assistants in Mississippi joined us. Anybody that stood for the physician-led team joined, and we began amplifying each other's messages, be it social media, traditional media, at the legislature. We just began communicating, and we began engaging our physicians more so than normal, utilizing every means possible, and drawing attention to the urgency of the scope of practice battle being waged in other areas of the country, and that we needed to be ready. It was increasingly becoming loud at the Mississippi legislature year after year. And while we really appreciate the congratulations, we also know that more is forthcoming. Every year we wage this, and our physicians decided several years ago that it was time to stop being on the defense and to go on the offense. So we've got more things planned, but social media was a big part of our battle. It was not by any means the only means, but our doctors really engaged. I mean, they just did. They called, they emailed, they went to dinners. They were very active. So kudos to our membership.
They really did. And some of the things that I saw was videos that they made where physicians actually spoke out and talked about this issue. Now, how did you get doctors engaged and fired up about this? What steps did you take as an organization?
We really took an interest in mentoring our younger members, especially those who are social media savvy. We used groups in which we already were located to communicate. We used some email campaigns, but encouraged them not to use standard verbiage, but to really tell the stories of why they were passionate the way that they were. So a lot of on the ground discussions in our support groups that we held for the doctors, especially during the pandemic. We were already having these support groups. So it's easy to morph those conversations into scope, and why burned out physicians fighting a pandemic really did not need to be fighting a scope of practice battle. So that went really well, and it just was a natural thing. And I'll be honest, I think it fought a lot of the COVID fatigue because it brought us together against a common situation. So they wanted to be engaged and they wanted to fight something that they could win. We've all been fighting this deadly virus. And so it really, in a weird way, was therapeutic, and we enjoyed being together in the battle.
How did you get the PAs on board? And to me, that was one of the most interesting parts of this, because obviously from Washington State, we have PAs fighting for independent practice.
Right.
And I suspect they will get independent practice, and obviously we'll end up seeing a lot of fallout from that in our state. But how did you get them on board? Because I really do think the PA physician collaboration is such a valuable medical collaboration or team. And it just seems like it's breaking down out here out West.
Yeah, in Mississippi, the PAs, of course, are trained more on the medical model, and they come under the direction of the Medical Licensure Board. So also our association and theirs have always had a wonderful relationship as far as sharing some administrative responsibilities and conferences and things. And they have come out publicly and continue to support the physician-led team. Of course, nationally that differs some. And so, all politics is local. In Mississippi right now, our relationship is very healthy with the PAs, and we hope that it always stays that way, because we believe so strongly that the physician leads the team. But again, just hats off to our on-the-ground folks. We had PAs standing up for us. We had physicians, and then we just thought, these nurse practitioners, these are our friends, and they're on our team. And we're hearing time and again that they are not with the national lobby narrative. And so we just started asking them, and we started encouraging doctors to ask their nurse practitioners to stand with them. And they did. I mean, we had nurse practitioners on social media. We had nurse practitioners who called senators and emailed senators. So, it really was a partnership across the healthcare spectrum of folks that stood up and said, we believe in the strength of a physician-led team.
Do you have a feeling for how many nurse practitioners in the state of Mississippi were sort of with y'all, and how many were with the legislator who wanted to get this law passed? Do you have a feeling for?
I didn't hear a lot of racket from the ones who were for the law. I mean, we heard a lot from the lobbyists, but on the ground, we mostly heard from our team members who enjoyed being part of the team. Another critical part of our battle that I'll tell you about was the state wide polling that we did a couple of years ago through the Mississippi State University Social Sciences Center, again funded by grant money that we had applied for. We just went to the public and polled the public and had a statewide statistically significant poll to ask the public what they wanted. I mean, these are the constituents of our legislators, and they're interested in their voices. And not surprisingly, you can imagine what the public said.
Yeah, I have those in some of those screenshots that you posted on social media here in front of me, and they were really remarkable. And I was going to ask you about how you gathered this data. So some of the things that you've made little graphics, and you have things like 95% of Mississippians surveyed want to know the level of training and education of their healthcare provider. I mean, it makes sense. We want transparency. 9 out of 10 Mississippians believe a physician's education and training are necessary to ensure patient safety in the event of a medical complication or emergency. So, I mean, over and over again, you have all these statistics that just show that patients want physician-led care. So this is information you gathered this a few years ago then.
Yeah, it was a couple of years ago, kind of proactively seeing what was coming down the pipe. And I'll say too that we have a physician executive director in Mississippi. There's only one other state in the United States that has a physician, and that's Hawaii. And we believe that physician leadership just has insight into things that perhaps other folks may not. And our board is extremely engaged. So we have physician leaders that really pushed this poll and said, look, we know the public is going to support us. And in fact, our polling showed that most of the public thought that physicians always supervise nurse practitioners on site. And of course, we know that year after year that changes. Here it used to be on site, and it was 15 miles, and it was 75 miles. Now it's state borders. We continue to give every year. And the way I keep describing it is our backs are against the wall at this point. And we have nothing else to give when it comes to patient safety. There just is no compromise when it comes to patient safety. So we also ran statewide billboards with those graphics that you're talking about with the same grant money. I mean, border to border, we have several times run the statistics so that the public can also see. We've engaged our public about physician-led team-based care.
I think that this is really the key, and it's so critical that we need to go directly to patients and reach out to them, because they're the ones that are getting the care, first of all, and they're also the ones that can communicate, like you said, so clearly with legislators, because Absolutely. Those are their constituents. So I think that was brilliant.
Well, thank you. And I think too, engaging, I want to say again, nurse practitioners. I realize the national lobby, and I realize that there are very vocal minorities, but there are a lot of great teammates out there that want to stand up for their doctors, and engaging them is key, and empowering them to speak up, and empowering doctors that it is not arrogant to say that medical school matters and that all patients deserve physician-led team-based care, and normalizing that conversation we feel like is extremely important.
Yeah, I noticed that oh, sorry, go ahead.
No, I was just going to say, I think you're right. I think even after we published this book, we've heard from so many nurse practitioners who said, we don't agree with our national lobby. Right. We don't necessarily agree with these organizations. And it's so frustrating that, they're going against kind of everything that we believe in, that's physician-led team-based care, like you said.
They feel abandoned. That's what I heard. I mean, and they keep hearing this narrative that, well, collaboration will continue. Well, we know that sidewalking somebody for their opinion is not the same as intense, true collaboration. And also, there's liability with sidewalking an opinion. That's not going to continue in the same true sense. No matter how many times we say that, it doesn't make it true, right? And so that's been an important point. Why you brought up your book. Thank you to you guys. We made sure every legislator in Mississippi got a copy of the wonderful book that you guys wrote. It was just a great exclamation mark to our campaign, because we think that awareness is important. We actually got feedback from some legislators that the book was awesome. They really enjoyed reading it. So thanks for that.
Thank you for that feedback.
That just means so much to me,
Yeah.
and I'm sure to Naran too, because we just we put a lot of time and effort into this book, and the whole reason was just to lay out what's going on in one place to be a resource, even though, we could probably do volume 2, 3, 4, and as things are changing all the time, but there's really no resource out there as of now, or there wasn't, that put out all this information in one place so that people could just have access to it at their fingertips.
Well, the title says it all, patients at risk. It's why we do what we do. It's why, so many of us do this for no pay, and in fact, lose money on the advocacy. But we believe in it because we went into medicine to do no harm.
Absolutely. And you mentioned with the nurse practitioner collaboration, I think that's so important. And Naran and I do receive a lot of supportive emails and letters from nurse practitioners, but they're all often very afraid to speak out. And so you guys had a few nurse practitioners on some of your videos where they actually were interviewed with their physician that they worked with, and they gave examples of cases where having that physician right there on site really made the difference to helping patient safety. I think that was so helpful. And then you've done a lot of things on social media where you've posted, that whenever a nurse practitioner has shared something positive, you've shared that and said, this is what our NP colleagues are saying. They're amazing. And they're the ones that are not driven by the AANP agenda. And they actually want this type of practice, which I think is a lot more than are willing to speak out and say so.
Yeah, totally. They do get some pushback sometimes. There's a little bullying involved. So I think it's important to our physician colleagues who are listening to seek out those relationships, with people who are fearless. That's important because nobody's going to do anything to them of substance for speaking the truth in the name of patient safety, right? That's the most important thing. And so we found, true warriors that believed in patient safety and believed in their doctors and what their role was on the team. And we encouraged our doctors, if you know these people, please bring them forward. And as we started talking, and as they realized, hey, these 10 people are speaking up, then 10 more wanted to speak up, and there's safety in numbers. So the more that people find out that it's okay to speak up, it just got easier and easier. And I hope that's going to have a domino effect across the country.
I think it will. And I think your point is really well taken, which is that doctors probably, if we want to speak out about this, doctors need to talk with the nurse practitioner that they are working with and get to, because, we do work together so well. And so many of us are really dedicated to the practitioners that work with us. And so we're their allies and they're our allies. And so we really need to use that real true team approach to discuss why it's so important for patient safety.
Well, and like you guys having us here tonight, Mississippi has really, I have a lot of reasons why I think that we lead some on the scope of practice front, but a lot of it is the physician leadership, and that a lot of us were already really involved nationally as well as on social media. So it's just kind of a natural morph. But we are coaching other states, and we are always available for consultation. We're working directly with some of the national voices out there on. This is not that hard. It seems daunting, but you just break it down like every other task, and it starts with those personal relationships. And we had, like I said, plenty of nurse practitioners engaging the legislators for us and standing up for us. And so it's almost flipping the script. And it also just it changes the way you look at it. The respect is there. There are many on the ground people that are just looking for a safe place to speak up, and having those conversations makes all the difference.
Yeah, you're right. I think the safety in numbers, and it is scary to feel like you're the only person out there speaking out and not knowing how this could impact your potential to get a job or how you're going to be treated by your colleagues. And I think the word warrior is the right word, because the people that do speak out, they are brave and they really are dedicated to patient care. And so I just applaud them so much for being able to stand up and say the truth and to advocate for patients, because patients can't advocate for themselves. They don't know this.
The next tack, I think, in this is looking at the educational model and the educational oversight in our country. There are, I'd like to see ACGME, I'd like to see other medical education overseers speak up about the value of medical school and the differences. I'd like to see, some comparisons between the education and how we train right now as teams. We train in the medical schools on a team, and that this would create a silo of care. In Mississippi, we were concerned that it would be a dual system of care. So we know that nurse practitioners are held to the level and training of a nurse practitioner in court. and physicians are held to the physician standard and can't testify as expert witnesses, as you guys well know. Well, that's not right for our areas that are underserved now. When regulations are stripped better than they've ever been before, you can get telemedicine to rural areas. We've got Bluetooth stethoscopes. We're going to throw the baby out with the bathwater, and this is just not the way forward. These guys deserve the same standard of care. You can't tell me these rural poor areas deserve to have a malpractice standard in the event of an adverse event, that their level of what they could recoup in court is less. And there's just such room to talk about and educate. And the legislators seem to listen to that. The double legal standard is important.
So few people understand that double legal standard, though. I literally for the book went through the Westlaw, which is sort of like Google for law cases,
Oh, yeah.
and looked all across the country at all of the wrongful death cases involving any non-physician practitioner. And it was just so interesting to me that they always ended up coming down to that same piece that, well, I thought it was a pediatrician. And they said, well, no, actually it wasn't. Well, but they were functioning like a pediatrician. So I thought if they didn't immunize, or whatever it was, there was a child who died of meningitis. And I felt so bad for the family reading it, because this was an OB, it was in Illinois, I think, and it was an OB trained nurse practitioner working in a pediatric practice. And they just told the mother who'd lost her child, I'm really sorry, but you didn't have a pediatrician. Right. And they dismissed the pediatricians, and the nurse practitioner couldn't be held to the standard of a pediatrician.
It's so tragic. And we hear a lot of stories here about, well, a nurse practitioner saved my life in Mississippi. And we said, that's great. Collaboration works. There's a physician at the head of that team. And we want to definitely keep that in place. Why would you remove the physician from the care team?
It's never made sense to me. And like you said, we've worked with nurses for, years and years and years, and they're so often our eyes and ears. And when a patient is saved, I've always felt like it has been a team. It's every other person that's been in that room, in the hospital or in the clinic or wherever. And I think we've lost that. Like you said, this dual system all of a sudden, when there's this power play, is sad, because it's the patients who suffer.
The legal standard back to that, we've got my dad's roll top desk in the background here. My dad was the first federal public defender for the state of Mississippi, and he retired a couple of years ago, but he started the office and grew it. And so I grew up watching him in his private practice, and then watching him take on big name federal clients and so on. And legal standard has always been in the back of my mind. And watching this is the craziest thing unfold, because the lawyers are watching it as well. And there's one standard of care. There is one standard of care. And we are literally experimenting on patients across the country right now with these arbitrary designations for who can independently provide medical care that did not go to medical school. And if you went to medical school, you know what it's going to look like in 10 years. And I just always have focused my advocacy on doing the next right thing. And so I have made a lot of noise personally. Our association has. People are going to do what they're going to do. But I'm not going to ever be sitting here 10 years from now and somebody asks me why I didn't tell them.
Yeah, that's exactly why I think, a lot of times doctors will say, the horse is out of the barn. There's nothing you can do at this point. Just give up. And, I can't do it. Or they'll say, well, let the buyer beware, and the patients will just, I can't do it, because it's like you said, it's standing by and watching people be harmed when, maybe what I say and do isn't going to necessarily have a direct impact today or tomorrow, but that doesn't mean that we shouldn't keep saying it, and that eventually it won't start to resonate. Because I think one of the things that I recognize is that a lot of times our eyes are not open to this issue. For mine were not for many years. And then, and many doctors that I know are like this. And then, but suddenly when your eyes are open, you can't unsee it. And then you're seeing it everywhere. And that's why we have to talk about this, to raise awareness so that people do see it. And that's what will affect change.
Well, you ladies are wonderful with that, with bringing awareness. And I think for the organizations listening, it's important to engage your members, especially your younger members, on this, and just to normalize the conversation. It is okay to stand up and to say, we head the team. That we do. That is not arrogant. It is not stuck up. It is the truth. Physicians lead the medical care team. But as that becomes normal to hear, it is not disrespectful to anyone else to stand up and say, that a physician is the head of the team. That is what we train for. That is how we train. Once that conversation gets easier to have, and more people, like you said, that are more naive about politics start realizing the importance, I believe that things are going to change. And I think that you guys are making a difference by continuing the conversation and continuing to push the narrative.
I have been so surprised by how many doctors, I mean, and again, I just get emails or messages on Facebook saying, wow, I'm halfway through your book. And I had no idea. I just, like Rebecca was sort of saying, their eyes have been opened. And I think it's true of the public and a variety of other sources, but you're right. I think it is about language, and it is about being really clear that if I am saying a physician-led team is how I think patients are best cared for, I'm not saying something negative about a nurse practitioner. I'm not saying something negative about a PA. I'm not saying something negative about anyone. I'm saying we should be working together and we can do more. And of course, I always talk about the Burlington model, which it's amazing that the AANP uses it to talk about independent practice, and it wasn't independent practice at all. It was the most beautiful collaboration between two family docs and two very experienced nurses who wanted to collaborate and wanted simply the same goal. They wanted to serve more patients in their province in Canada. And being from a rural area like I am, to me, I get goosebumps when I talk about it, because it's such a perfect way to deliver more care or better care to more people, basically. And
yeah. I mean, having those extenders of the team is just crucial, and giving them the respect that they deserve is important.
Absolutely.
And separating a national lobby and a false narrative from the individual who we value is very important. My best friend is a nurse practitioner. I will tell anybody who will listen, right? I think I have her in my ear at all times. What I say would I anger her, right? So that, I mean, those relationships matter. But I'm so glad that you brought up, the rural care and the outcomes, because in Mississippi, another key component is Hattiesburg Clinic. And I would be remiss if I didn't mention the Hattiesburg Clinic data. They are the largest physician group in Mississippi. They cover most of South Mississippi, a large footprint, a lot of rural clinics there. And across a patient population of tens of thousands of people over the past decade, proved time and again that physician care on physician-led patient panels was superior to the patient care provided on nurse practitioner panels. Now, that's not to say they didn't collaborate and do the chart review, but patients identified their PCP as a nurse practitioner. So they didn't have the required, you must see the doctor every third visit or so on. And so as we moved into the ACO model, Hattiesburg Clinic found out that the quality was not where it needed to be, and the income wasn't either, and they could not afford to stay in business with that model. And so they changed. And now they have the entire physician-led model, and their policy is independent of any law. We're not going there. We can't afford to do business that way, and it's not fair to our patients with the quality. With the EHRs and the ACO data, I think you're going to see more and more and more of what we have been saying here, what you guys have been saying in your book, which is the team works better together and to keep the team together.
Yeah, it always has. It's shocking to me that somehow we veered off sideways, as one of the few countries of the world where we're just kind of winging with no data.
That's such compelling evidence. And isn't Hattiesburg Clinic, are they a federally qualified health center?
No, they're not, but they are the number one ACO of their size and position in the country. And they actually work directly with Epic. I know you guys probably are familiar with the software company, and with giving talks around the world and all across the country at how they did what they did. So many groups and hospitals and clinic systems are looking at Hattiesburg Clinic. So this is not a 1,500 square foot building. This is a large conglomerate of clinics. And they make a lot of money. And they are a physician-led clinic, a physician board, physician CEO, which again, we believe makes a big difference.
Sounds like this is going to need to go in the updated version of the book in the second edition for sure.
Absolutely.
Because, I mean, I know Hattiesburg Clinic, they're amazing. And I didn't know about the new research, but they serve a huge underserved rural needy area. And I mean, that's very impressive that they were able to gather that data. And because, really, we don't have a lot of real hard data on this issue. The data that's there is very sparse. They talk about the last 50 50 years of having nurse practitioners. And there's only like 18 studies that have been able to be analyzed to show whether nurse practitioners are safe and effective. And of those, only 3 were performed in the United States. And that was published in 2018. And really, there hasn't been a whole lot of really good literature published since then, including in states that have granted independent practice.
And the
So
last
There's not, I mean, there is no study that shows that independent nurse practitioners provide equal or superior care to physicians. There won't ever be a study that shows that. I would be shocked. But Hattiesburg Clinic clearly shows the data, and I think we'll probably see more out of that when we have the raw data. We had this scope battle kind of thrust upon us, but in looking at the data, it is clear and it is compelling and it is statistically significant. So I don't think this is the last we're going to hear out of Hattiesburg Clinic or other organizations.
Well, I think in particular, it's important to mention that the Hattiesburg Clinic is physician-led. So the organization is physician-led. And I think that's what makes it so unique. As you get these larger, like you said, conglomerates, I mean, it's amazing to hear of a conglomerate that's physician-led. It's no surprise they're providing top-notch care. They've got a team approach. They're really thinking about patients. Obviously, as these hospitals keep collaborating, you know, we're not physician-led hospitals. And so, I mean, that was made illegal actually in the 2010 Affordable Care Act. So again, it's unfortunate that that was a piece that was enacted, because I think most organizations, when led by physicians, are safer for patients, provide better care, and can actually collect the data to prove it.
And what's really interesting is I think they have about 150 nurse practitioners within their system, and they are all collaborating happily. I mean, it's working very, very well for Hattiesburg Clinic system, both financially and patient quality. So, you know, it's no surprise. I think Hattiesburg Clinic is a great partner with our state medical association, and helping with our advocacy. We have partnered with them very closely, but they have foresight. The physicians have foresight. And our CEO is a physician at our medical association. Physicians can resoundingly say that we know medical school matters. And while outsiders may holler that, you know, you're full of yourself and it's your ego, we know what we advocate for. And in a lot of ways, I liken this to the pandemic mask argument and all of the things that we've argued over the past year, right? The science and all. We've got physicians. We say what we're doing. We do it to the best to take care of the patients. We put it out there, and then people are going to listen, and people are going to do what they're going to do. And here we're saying very resoundingly that physician-led team-based care is the best model of care. And I think it's on everybody else to debunk that.
it makes sense. I mean, it's only kind of logical. But so you guys did an amazing job at presenting that information. So just last week on February 24th, I believe it was, Senator Bryce Wiggins posted on Twitter, breaking, Senate Public Health Chairman just announced during committee that the NP scope of practice bill would not be coming up in the Senate this session. Reason: the issue needs to be properly studied and looked at.
Yeah.
So that was huge. I mean, of course, we know they may try to sneak it in there or somewhere else, but this says that really you were successful at making it clear that we just don't know that this is something that's safe and effective. And we know what is safe and effective, which is physician-led care.
Absolutely. Senator Wiggins has been a great friend of medicine. So many of our legislators at the Capitol have been, but he's been one that's just championed physician-led team-based care. And when he broke that, it was a great celebration heard around the state for many of us.
Yes, congratulations. I'm so impressed by all the work that you guys did and all the ground, sort of the grassroots inspirational kind of approach. Yeah, I think it's tremendous.
In our last couple minutes, can you tell us a little bit more about the support groups that you guys formed for COVID and of course, how that ended up helping with the scope of practice? This sounds like something that we all might want to look at doing in all of our states.
Yeah, certainly. Thanks for asking. In Mississippi, we're a smaller state. We have a wonderful relationship with our state health officer and our state epidemiologist. And so we were already partnered with them on some communication and education pieces with social media and so on. And so we were engaging our doctors and making sure they had the latest public health orders, and we were doing that in some private spaces. And as that grew, doctors would kind of attach to us and talk about, how do I get the PPP loan? I'm stressed out about this. What's the next order going to say? When can I do surgeries again? So we started up with our professionals health program. It wasn't through them. We just kind of got some of their experts. And we started some online Zoom meeting type support groups. So we had both kind of written and Zoom type interfaces where we would interact with our membership and hear the daily stresses, and we kind of blogged daily in different media spaces about, hey, I've got a patient. What do I do with them? What do y'all think about this? Whatever the latest greatest drug is. That day-to-day support was there, as well as designated support time. And then as scope of practice came up, it was very easy to transition those conversations because they were already frustrated, they were already burned out, they were already fighting the pandemic of their lives and stressed. We had lost colleagues that we had memorialized together in those spaces. And so when scope of practice hit, it felt tone deaf to our doctors, and it was a common foe. And they were enthusiastic about standing up for the physician-led team. And I think that it brought them, I don't know, it brought them together and it allowed them to kind of get some frustrations out and stand up for patient care.
Well, Jennifer, I just want to say how inspired I am by you. And you are just the perfect example of how physician leadership matters. And you and your colleagues have done a tremendous, amazing job. I want to thank you. Have personally inspired me. And I know so many other physicians out there. And so thank you so much for what you've done.
Well, that means a lot. Both of you ladies, I have admired your work as well. And it's a lot of fun for me to get to connect and collaborate with you on this project, and look forward to continued wonderful things from you guys.
Well, thanks
Thanks
so
again
much.
for coming on.
All right, absolutely. Y'all have a great night.
Thanks so much. Please subscribe wherever you listen to podcasts and check out our YouTube video. And if you'd like to learn more, you heard about our book already, and we'd certainly welcome you sending it to your legislators. There are some discounts available for bulk purchases, so you can reach out to us for more information. But just for individual purchases, the book is available at Amazon.com and at BarnesandNoble.com. It's called Patients at Risk: The Rise of the Nurse Practitioner and Physician Assistant in Healthcare. And if you're a physician and you're interested in learning more about advocating for physician-led care, definitely reach out to your state medical society like Mississippi, and also join Physicians for Patient Protection. You can find us at physiciansforpatientprotection.org. Thanks, and we'll see you next time.